certainly today. So I'm Danielle Clore, CEO of Kentucky Nonprofit Network. And again, with us is Dr. Stack, our Commissioner of Public Health. We're not even going to read his bio this morning. We're going to put that in the chat if you have any questions. So Dr. Stack, thank you for being with us. We're eager to hear, with this rapid rise in Delta variant cases, kind of an update. How did we get here, and how is this situation different than where we were in 2020?
Right. Thank you very much. I appreciate it, Danielle. And I have your questions that were shared. I'll try to address those from top to bottom as well.
Okay.
First of all, thanks to all of you for your leadership, and thanks for the service that you provide for your communities and the population you serve. I continue to be very grateful and appreciative of all the goodness that's out there in society. This is not the same as last time. The rate of rise is far more quick. We have managed to rise to case levels in 4 to 5 weeks that took 21 weeks to achieve before. The hospitals are filling up. We will overtake our previous all-time record of COVID hospitalizations probably within a week. They don't have the same amount of staff that we previously had. So we will have constraints of hospital capacity. This will affect not only COVID patients, but non-COVID patients. This means people who seek emergency care may find themselves at smaller hospitals unable to be transferred into bigger hospitals. People will find that the nursing ratios have to be extended so that they should not have the same expectations that care will be as usual. Hospitals are going to have to take unique and different measures this time. What has happened in states around the country that we managed to avoid in Kentucky for a year and a half will happen here now. Let me be explicitly clear, this does not need to happen. It is happening because a large proportion of the population has chosen to not be vaccinated, and a significant proportion of the population continue to refuse to wear masks and adhere to public health guidance that would make this crisis unnecessary. In the hospital, the data still shows at present that 9 out of 10 people who are in the hospital or the ICU or on a ventilator could have been prevented from that misery and suffering had they been vaccinated. The Delta variant changed all of this. We were on a wonderful downward course. The pandemic was becoming under control, and we were able to move on and liberalize our practices so that people could get back to more of the lives that they missed and they previously knew. Regretfully, because we have enough vaccine in the United States of America that every single human being in the United States of America could have been vaccinated by now for every single person 12 and over. If that were the case, this would not be happening now. Period. Hard stop. This is not a matter of debate. This is a factual reality. And so I think we have to be explicitly clear, those of us who are leaders, that people may be entitled to their opinions, but they are not entitled to their facts. And so in this case, this is not necessary. This could have been averted. We are now going to have people get hurt that did not need to get hurt, not only for COVID, but for non-COVID as well. So there will be collateral damage this round because there will not be sufficient capacity. There is not sufficient capacity primarily, not only because of, but initially because there's not enough qualified medical personnel. It was so distressing and so traumatizing to go through the earlier rounds of this experience that a number of folks who were close to retirement and did. Others who said, this is not what I signed up for, I can't handle this, chose to move on from the professions. So there are now hospitals with high-grade medical quality beds and treatment facilities who do not have qualified staff to operate them. Field hospitals are not the solution this time. This time, it is an immediate problem of not enough staff to provide the services necessary. So I'm being this explicitly clear because if we don't have more people in society speak up as leaders and represent what is actually happening, if we continue to allow people to falsely equate TikTok, Facebook, and Twitter with people with MDs, PhDs, Masters of Public Health who have devoted their whole professional lives and educational journey to serving society as experts in these fields, and TikTok, Twitter, and talking heads who are spewing forth absolute rubbish are the definitive or authoritative sources people turn to, then we in society are in trouble in much larger ways than just this pandemic. So I want to urge and ask that everyone here who's a leader in your communities, please take this message to heart and try and do your best to help convey that message through your communities. That we are long past the time that this is a mystery and an unknown. There's so much more we know a year and a half in. And now let me directly address the questions about vaccines. As of today, we have more than, I always hate when I do this off the cuff. We have about 2.1 million fully vaccinated Kentuckians, 167 million fully vaccinated Americans, 1.6 plus billion fully vaccinated human beings on the planet Earth who have been vaccinated with more than 4 billion doses of vaccine over the span of more than a year. These vaccines are not experimental. These vaccines are the most highly scrutinized, highly monitored, and most rapidly deployed pharmaceutical interventions in all of human history. They are modern medical miracles. They are overwhelmingly safe, and they are infinitely more safe than getting the disease and the consequences that go with the disease. So the messages to the contrary are false and directly harming people. Now, please, I am so careful to always qualify this. There is no risk-free journey through life. All decisions have risk. And there are some small number of people who have gotten vaccines who had adverse outcomes related to them. And that is a tragedy for those families. And for those families, 1 in a million was 100%. And so let's not lose our empathy and our sympathy for those folks who find themselves in that situation. But overwhelmingly, hands down, without dispute, the vaccines are safe, they are effective, and there is no objective basis to assert that there is a more rational path than using vaccinations as a way to avert this crisis than to allow the disease to continue to run rampant through society, fill up hospitals, and cause all of society to suffer lack of absence to quality healthcare when they need it in their time of emergency. So I realize I'm being particularly pointed today. I hope I'm not being inflammatory or needlessly dramatic. I just think people have got to understand. And of course, there are many of us who are quite frustrated at this point that we have shown slides and data and evidence, and someone who puts up a TikTok video next to all of that community of experts is given the same standing and credence by many. Not if it were just a few, it would be one thing, but it's by many. And we are now in a situation where society as a whole has to seriously look in the mirror and reflect. We have absolutely disregarded the gift of intellect that humanity has been given because of the shortcomings of our psychology and sociology. And this is a serious conflict that we have to address as a community. So I am very grateful for your leadership. As I said on a previous version of this, I spent most of my life in nonprofits, professional associations, and have had a wonderful lifetime journey of camaraderie and personal growth and development with those friends and colleagues I've met in those settings. And so though I may not know or be involved in the vast majority of things you all represent for your different communities, I certainly appreciate how the people who engage with your associations find value and meaning and enjoyment as they go through their human journey. So now let me.
Yeah. Thank you, Dr. Stack. And I think you need to be pointed. We're past the conversation point. And I think we've got probably 2 questions really for you about our own events. And should we be having them? What should those look like? How is this time different, than when we were kind of closed down? Should we be, given the vaccine is out there?
So we have on our website minimum guidance, which I would encourage every organization that convenes to look at. This is for all settings. So if you go to kycovid19.ky.gov and you look down on the left, there's one tab left. That's all that's left, one tile of healthy at work. But in there is minimum guidance. Those things are general best practices. Those have not changed. You should try to do activities outdoors. You should, if you have to be indoors, try to facilitate space between people. We've used the 6-foot guidance in the past. That still is relevant. Sanitize highly touched and commonly shared surfaces. If you can increase ventilation in spaces, do so. If it's nice weather, open all the windows and have fans circulating air. Anything you can do to circulate air and increase volume. This is a complex disease. It affects many organs, not just the lungs, but it is first and foremost a respiratory disease. And so it is spread through respiratory transmission overwhelmingly. And the Delta variant, unfortunately, has made the disease far more effective than even before it may infect as many as one. So one infected person previously probably infected 2 other persons. Now we think Delta, one infected person can infect 6 or 7 other persons. Now, I think it's rubella or measles. Measles is 1 in 50. One person can infect 15. That's the most contagious pathogen currently, viral pathogen in the human population, I think, that we're aware of. So it is incredibly higher risk now. And so the previous reassurance that outdoors was really protective is yet to be determined, but it is clearly lower risk to be outdoors and in places with greatly circulating air than indoors. So you asked very specifically, what should you do with your events? I think if you have indoor events with people in close quarters, I am not even having meetings with groups of people in my office anymore. It's just not a good time. The vaccines protect very well against severe disease, death, and hospitalization or ICU admission. They don't fully protect against getting the disease. So we shared this, many, many months ago about we didn't know and the concern. Well, it turned out for every variant up till Delta, they actually did stop you pretty much from getting infected or spreading the disease. Delta got better, and that's terrifying. And now that Delta is better and Delta can spread to people who are vaccinated, who then have viral loads as high as unvaccinated, so they can then spread to others. We now have a situation where you are much better protected by being vaccinated, but the protection for everybody else is not quite as high. In order for us to get community level protection, and I'll call it community immunity instead of herd immunity because we're not cattle. In order to get community immunity, because this Delta spreads so much better, we probably now have to get over 90% coverage of vaccination in order to provide the same protection that we might have provided at 70 or 80 with the earlier versions of the virus. We should not despair over this. We have shown that this is a vaccine mitigable disease. We can curtail the virus and curtail its worst harms with vaccines. And I have confidence that the scientists will evolve and innovate the vaccines as we need to, and that we will be able to preserve effectiveness of vaccines. But as long as large swaths of society choose to opt out of vaccination for unscientific, unfounded reasons to the contrary, we won't have the benefit of that protection. So I would encourage you to not do indoor events. Outdoor spaced out events is still probably, we got to move on with our lives in some part too. We all know that. Yeah. Outdoor thinly attended events is probably fine, but I would not go to a packed stadium right now, because if you're sitting shoulder to shoulder and front to back with people in that close space shouting for 2 hours, I don't think you can take confidence that you're safe.
Yeah. So, Dr. Stack, quickly on the quarantine issue, how do we handle that with employees and those kinds of things? If they have been vaccinated and exposed, has quarantining guidelines, have those changed?
So things continue to evolve, but the guidance in this regard stays the same as it has for the last month or two. If you are fully vaccinated and exposed to a person with COVID, as long as you do not have symptoms, you do not have to quarantine. All right. So if you're fully vaccinated, exposed to someone with COVID, but you remain asymptomatic, you do not have to quarantine. The guidance changed, though, to say that you should get tested 3 to 5 days after your exposure. And if at all possible, you should wear a mask whenever you're close to others until you have your negative test. Because Delta, not only does it transmit much more easily and have higher viral loads, early data seems to suggest that the incubation period may be 2 to 3 days shorter than the previous versions. So when we have anecdotal stories of people declining rapidly, they don't decline on day 8 or 9, that they come in the hospital, get sick and fall fast. And on day 5 or 6, they're critically ill. This version of the virus appears to take hold and escalate far more rapidly than the earlier versions. But if you are unvaccinated and you are exposed, you should quarantine for 14 days after your exposure, and there's other criteria. And on our website, and this is under the healthcare and lab tab, you can look for the quarantine guidance. There's a one-pager that summarizes this in a more distilled version that's functionally usable, I think, for hopefully most of you. in your settings to operationalize it,
Mhm.
where the ways to get out of quarantine earlier are essentially to get tested on day five or later. And if you have no symptoms by day 7, you can get out earlier from quarantine.
Okay. And Dr. Sack, the other piece of this are what we as employers and as people interacting with our volunteers and our clients can do. And it's, there's so many articles out there. And I think there was one recently of a nonprofit how they had really grassroots on the phone with every employee, gotten to 95% of their employees vaccinated. Can you talk about the role that we as nonprofits can play of kind of depoliticizing this issue? Because you talk about vaccinations, which is important, but that's not going to have the immediate impact, which is where masking comes in and our events. So can you talk a bit about how we as nonprofits can be helpful in, as you mentioned earlier, our leadership role in our communities to kind of put the focus on public health where it needs to be?
So the first thing is arguing with, berating, castigating, accusing never has persuaded virtually anyone. So don't go down that path. If you feel the need to go down that path, you should probably just end the discussion and move on to something else. Okay, it won't persuade them. It will raise your blood pressure, and it just adds conflict in society. But if you can find a way to have a constructive dialogue, or you can just calmly and confidently convey factual information, I think that is helpful. Mm-hmm. So beware of false equivalencies, okay? So beware of the person who says, well, there's two sides to this, when in fact, there are 999 people on one side and one person on the other, okay? It's not fair to represent that as two sides. You can say there are different opinions, but everybody agrees with this opinion and someone else has this divergent opinion, okay? So I would say focus on factual information. And, if what I'm saying is not persuasive to some, I won't be able to change that. But mm-hmm. for those for whom it's persuasive, and let's not lose complete faith, the majority of society still has a respect for science, for data, for facts, for education, for reason. I think the difficult thing is we have got to mobilize more of society to speak up for the importance of that and not let it be continually normalized that insane, delusional conspiracy theories are credible views of the world in which we live. Mm-hmm. If we don't find a way to say, no, wait a minute. I understand that's your opinion, which is fine, but that's not a fair representation of the true, the true balance of society's understanding of the situation and where we are. So I think we have to remain calm, non-accusatory, and use fact and reason where it works, but focus on the people. If you are a politician, there's your mom, the candidate's mom, right? So your mom hopefully will vote for you, although that's not always the case. The candidate's mom is almost always going to vote for the candidate, the opponent, the other person. And then there's the persuadable middle, right? We need to get the folks who either agree and believe and the persuadable middle, and the folks who are going to doggedly not agree with this. I think we have to focus on the bigger, the 2/3 of people who fit within the persuadable population.
Okay. Yeah, I do. I just think nonprofits have a really important opportunity, and many, I think, have been fearful because it has become so politicized to even bring it up. And, there have been PSA campaigns. And so hopefully we will, as organizations, really kind of embrace how we can get solid information in people's hands. Are we looking, somebody mentions this about schools. Are we possibly returning to virtual learning, of us needing to be working again from home? Or again, is that different now? Because we do have vaccines, but again, not necessarily for kids under 12. So.
Right. So again, mercifully, children this is an age, the worst harms occur in an age-related spectrum. So the older you are, the more your danger. And 91% of our deaths are in people over 60. All right. But death is not the only adverse consequence of this disease. We have people who are, forgive me, my phone rang and it took me off my thing. We have people who are Under 12, about 660,000 of them in the state who are ineligible for vaccination. And then we have only 33% of the population between 12 to 17 are vaccinated. So we have, it's easy over 750,000 Kentuckians under the age of 18 who are unvaccinated. I continue to make this point. Very small percentages of large numbers are big numbers, okay? So let's just take the current the hospitalization rate in Louisiana at Baton Rouge General Medical Center, which is posting stuff on its Facebook page, for the pre-Delta phase was 0.1% of all persons under the age of 18. Mm-hmm. If we have 750,000 Kentuckians under 18 and 0.1% of them get hospitalized, that is 750 persons under the age of 18. In the state of Kentucky, if you are sick under the age of 18, the only two hospitals who can take care of sick children and adolescents are Norton Children's and University of Kentucky, who have between them a few hundred beds. All right. So let's just put that in context. Okay. Everyone's coming back to school. The disease is spreading like wildfire. The case counts have risen in 4 to 5 weeks as fast as 21 weeks last summer. It is not inconceivable for this to run through every child in the entire state in the next 2 months, in which case our pediatric hospitals will be overwhelmed and lack capacity to care for kids who otherwise almost certainly would survive and who now may not. Okay, so I mean, I could think of other examples of this, but the bottom line is we have to take measures, and it is disappointing to me that less than 1/3 of the school districts in the state followed the expert public health guidance of the CDC, the American Academy of Pediatrics, the Kentucky Department for Public Health, and all 61 public health directors serving all 120 counties in the Commonwealth. Mm-hmm. So I think we have a real issue here, and I will just tell you, we will do all we can. The governor took, a difficult move to impose a mask requirement in the K through 12 setting. After less than 1/3 of all the districts followed the unanimous opinion of public health experts in the state, the nation, and the local level. Mm-hmm. And I think at this point, parents are the ones who will have to make a determination where they are comfortable sending their children or not. It will have to be people engaging at their local school boards and with their local school leadership, because at this point, that is where this is local communities and individuals deciding what level of risk will I take and where will I send my children.
Mm-hmm. Mm-hmm. Yeah. Well, and I know you've got to go, Dr. Stack. One last question, and I think you've said it maybe not directly, but you've got organizations who are thinking, okay, well, by the fall or this winter, could that be better? I mean, vaccines don't work immediately. There's, in some cases, 2 doses in a certain period of time. And so it sounds, I know you don't have a crystal ball, but at this stage, for us to pull out of this, which you've said is doable, is not quick, right?
It's not. So what will unfold over the next 2 weeks or 2 or 3 weeks is already determined. We don't know what it will be. We'll see what it turns out to be. But the disease that's already in the community is already in the community, and we will now see the consequences. But the duration of the difficulty is what we can impact now. Okay. So if we all get vaccinated, those who are not, and we all wear our masks and we take extra steps, we could make this a brief duration of difficulty instead of an extended misery. Let me offer one other thing, because the question came in your chat box about the churches. Yeah. So whether it's churches, community centers, nonprofits getting together, if it is possible, and the community will agree to it, whenever possible, I think doing virtual activities for gatherings is well, not desirable, because we're grateful to see each other in person again, is probably a good idea. Where persons determine they're going to get together in person, again, whether it be church services, community gatherings, or anything else, people should wear masks at all times when in indoor spaces. And if you are unvaccinated and have any high-risk conditions, you should think very carefully before you put yourself in that situation, because you could still get sick now if you're among the most vulnerable in society. And so I think you should take extra care and precautions.
Okay. Very helpful. Thank you so much for being with us, Dr. Stack. And really I can't imagine, I know how frustrated I am, and I'm not even close to doing the job you're doing. So really appreciate the work of you and your team. And I'm really disappointed that we love seeing you, but disappointed you're back here with this message because it's so unnecessary, really.
Well, it is a privilege to serve. I wish we all didn't have to experience this together. But again, it is what it is, and we can just do the best we're able. And I just thank you for your leadership and urge and encourage you to escalate that leadership, because it is going to take many, many, many more hands in order for us to overcome this current challenge. So yes, I do have at 10:30. So thank you very much, and best wishes to you all. Stay safe. Okay.
Thank you, Dr. Stack. Really appreciate it.
Bye-bye.
Bye.